Welcome to Smoking and Heart Disease by the Heart Health Intervention Program. Smoking and heart disease risk. Smoking causes approximately 1 of every 5 deaths from cardiovascular disease. Regardless of weight, non-smokers have 1/3 the risk of heart disease as smokers. Smoking cigarettes with lower levels of tar or nicotine does not reduce the risk of cardiovascular disease. More than 33,000 non-smokers die every year in the United States from coronary heart disease caused by exposure to secondhand smoke. How does smoking affect the heart? Smoking increases the formation of plaque in blood vessels, causing atherosclerosis. Chemicals in cigarette smoke cause the blood to thicken and form clots inside veins and arteries, causing blockages leading to heart attacks. Smoking increases the risk for strokes. Smoking is also the most common preventable cause of peripheral arterial disease. Smoking is a known cause of early damage to the abdominal aorta, which can lead to life-threatening aneurysm. Almost all deaths from abdominal aortic aneurysms are caused by smoking. There are clear benefits of quitting. One study says, benefits of quitting smoking outpace risk of modest weight gain. The study found that former smokers without diabetes had about half as much risk of cardiovascular problems as smokers. This is about 0.47 times the risk for recent quitters and 0.46 for long-term quitters. They also said that within 5 years of quitting, smokers lowered their risk of stroke to about that of a person who has never smoked. So the damages of smoking can be reversed. So how do you quit smoking? Well, step 1 is to get motivated to quit. Write down the reasons why you want to quit smoking. Research about the risk of smoking and what it does to your body. For example, this picture shows that after 20 minutes of quitting smoking, your heart rate and blood pressure drop back to normal levels. After 12 hours, the level of carbon monoxide in your blood drops back to normal. After 2 weeks, circulation and lung function improve. At 6 weeks, your energy levels should increase. At 6 months, smokers' cough and shortness of breath will disappear. And after 1 year, your risk of heart disease is about half as high as the smokers. The second step in quitting smoking is making a plan. You need to learn new skills and behaviors. If you tried to quit smoking in the past, think about those attempts. What helped you during that time and what made it harder? Also know your triggers. What environmental cues caused you to pick up a cigarette? Then you need to treat underlying causes. What causes you to smoke? Is it depression? Is it fear or anxiety? Or your social environment? Step 3 is to get support. You should tell your friends and family that you are quitting and that you may need their help. You can also quit with a friend or go to a support group. 1-800-QUIT-NOW and smokefree.gov are resources for you to help you quit. Studies show that group behavioral therapy is the best kind of intervention to get people to stop smoking over pills, intensive doctor's advice, nicotine replacement therapy, and individual counseling. 4. You may want to get aid for medicines or devices. There are 3 types. Prescription pills such as Champix and Zyban that reduce your desire to smoke. Nicotine replacement therapy, which includes products such as patches, inhalers, and gum to wean you off of nicotine. And then e-cigarettes or vape to help you replace your smoking behavior. Step 5. Prepare for withdrawal. Withdrawal symptoms often lessen after only 1 or 2 weeks of not smoking. Each urge to smoke only lasts a few minutes. Make sure you are resting, drinking water, eating healthy, and getting some light exercise to mitigate these symptoms. Have someone help you with the feelings of anxiety or doubt. And also distract yourself by finding things you enjoy doing instead of smoking. Dealing with withdrawal can be difficult, but following these steps can make it much easier. 7. Know that you're not alone. You can find articles online, such as this one, about people's stories about quitting smoking. Quitting smoking is difficult, which is why many people fail to quit smoking. However, there are many resources, and if you utilize all of them, your chances of quitting smoking and succeeding go through the roof.